Okay, our next video clip on examination basics, we're going to look at ankle plantar flexion. So let's look at bilateral muscle power first. Come behind your patient and structurally look at the calf tissue. Does one side seem atrophic as compared to the other? Okay, and then ask the patient to do bilateral heel raises first. So Hannah, I want you to try to lift those heels up off the ground and try that 5 times for me. Now you can ask for more than 5. In this particular video clip, we're going to stop the muscle testing at 5. You can go beyond that to 10 or 15 if you want to. Bilaterally, the power looks pretty good. But the true test of plantar flexor muscle power, this test is done unilaterally. So let's have you bend your left knee. Okay? And now let's test the power on the right side here. So I want you to try to do that heel raise 5 times on the right. There's 2, 3, 4, 5. Make sure you're looking at muscle contour and definition. Ask the patient whether or not that was difficult to perform 5 or 10 or 15 repetitions of plantar flexion. And now let's do the involved side here. So bend the right knee and try and power that heel right up off the ground. Give us a little bit, yep. And it becomes apparent right away that the patient's not able to power that heel up off the ground. So let's test that a little bit further, okay? So Hannah, can you bend this knee for me? Okay. And now let's see you make this motion actively, plantar flexing like that, okay? So she's able to do a little in open kinetic chain, okay? So that's good. Let's continue with testing muscle strength. So try to plantar flex for me, okay? Now I want you to hold and not let me move you. In this position we could test for the strength of the plantar flexors. And again, if that breaks very easily, as it did there, okay, we know right away that there's a significant weakness impairment affecting the plantar flexor muscles. Okay, let's do just a little bit more of examination basics. Try to actively plantar flex just a little. Okay, let's just see if there's any element of pain. I'm going to bring 2 fingers right over the top of the medial aspect of the talus, and I'm going to pull that talus bone right in the plantar flexion. If that causes discomfort, there also could be a pain impairment, and maybe that was in part limiting our patient's ability to fully plantar flex the left ankle. One final thing, it's very easy to test end feel here. So I'm going to back away from the first stop and then repetitively test toward it into progressive plantar flexion. We're going to feel the first and final stop. Remember, if that stop comes early, if there's less motion and it feels very, very firm, there could be an element of anterior anteromedial or maybe even anterolateral ankle joint capsular shortening.